question. Right, so if you have read and understood considering this surgical and optimization, kindly tell me if you can identify in picture A, what are you looking at?
This is an anatomy dissection specimen showing the femoral triangle, ma'am.
Okay. If you can identify number 12 in picture A. Sorry, 13.
13 is inguinal ligament, ma'am.
Can you tell me the attachment, please?
It is attached to anterior superior iliac spine and pubic tubercle.
All right. What is it formed of?
It is formed by the reflection of external oblique aponeurosis.
Very good. Can you identify this long muscle or structure? Sorry.
It is sartorius
19.
muscle, ma'am.
Yes. Can you please tell me the origin insertion of this muscle?
It is from anterior superior iliac spine and inserted to the proximal tibia along the lateral aspect, along the
Uh,
medial aspect.
what is the nerve supply?
It is innervated by femoral nerve.
Okay. Can you please tell me what is the characteristic of this structure? What is it known of?
It is the longest muscle of our body,
Yes. And
and it functions as its function is to flex the knee joint and hip joint.
yes. And it also forms a
It
boundary of
forms
something. Yes, that I
lateral
want
border
to.
of femoral triangle
Yes.
and a roof of adductor canal.
Yes. Okay, good. Can you please tell me what are the other boundaries of femoral triangle?
The medial boundary is the adductor longus, and the superior border is formed by the inguinal ligament. And
O-
the floor is formed by iliacus, pectineus, and adductor longus, and a roof is formed by superficial fascia, tensor fascia lata, and
Can you,
superficial.
okay, good. Can you please tell me what are the contents of femoral triangle from medial to
Uh,
lateral?
the condenser, femoral vein, femoral artery, femoral nerve, superficial and deep inguinal lymph nodes, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, great saphenous vein.
Can you please tell me how the femoral sheath is formed?
Femoral sheath is formed from the transverse abdominis fascia and the iliacus fascia.
Yes. And it,
It is a funnel shaped
yes, yes,
extension from the abdomen to the
approximately four
thigh,
centimeter. Yes.
approximately 4 centimeter long. Through which the femoral vessels enter the thigh from the abdomen.
Right. This femoral sheath or femoral triangle is divided into certain. It's
Compound.
divided into certain compartments. Yes. Can you tell me about the most medial compartment?
The most medial compartment is also called a femoral canal.
Yes.
It contains loose area, connective tissue and the cloaked lymph nodes.
Yes. And fat as well. What is the purpose
Right.
of this femoral canal, the empty space in the femoral canal?
The physiological significance is that it allows for the expansion of femoral vein,
Yes.
and the pathological significance is that it is the space to which the femoral hernia happens.
There are two terminologies, muscular lacuna and vascular lacuna. What do you understand by them?
Vascular lacuna is the space under the inguinal ligament uh, through which the femoral vessels enter the femoral triangle, and the muscular lacuna is the muscular compartment located laterally under the inguinal ligament.
Yes. And medially it contains.
It contains UFS, lateral nerve type.
Yes. Can you, in the image on the right-hand side, be able to recognize the structure which is labeled 14, please?
14 is superficial femoral artery.
Can you tell me what are the branches it gives and at what point?
I will come back to it.
Okay, sure. Can you also identify this structure lateral to 14?
That is femoral nerve.
Okay. Right. Can we? All right. You told me sartorius also forms the one of the boundary of the adductor canal. What is adductor canal and where is it located?
Adductor canal is in the muscular compartment that is located around the middle third of thigh along the medial aspect.
Yes.
It extends from the tip of femoral triangle. The roof is formed by the sartorius. The lateral border is formed by vastus medialis, and the posterior border is formed by the adductor longus and adductor magnus.
Okay. Right. We'll move on. If you can identify the image on the left-hand side, please.
Yes, ma'am. This is a femoral arteriogram
Yes. What can
showing
you?
femoral
Yes.
artery.
What are the? Yes.
One is the femoral artery or external iliac artery. Two is femoral artery,
Yes.
and three is lateral circumflex femoral artery.
Okay. If
Four
we
is
move on to the right-hand side image, would you be able to identify number 2?
number two is femoral artery.
And what kind of image is this?
This is a femoral arteriogram.
Yes. And
Contrast is indicated.
okay, good. In which conditions do we ask for this image?
When we suspect any limb ischemia.
Okay, good. Can you also identify the remaining structures that you're looking at? 3, 4, and
Three is
6, 7.
lateral femoral circumflex artery.
Okay, 6,
Lateral circumflex femoral artery. Six is superficial femoral artery.
7.
Seven is profunda femoris.
Okay, good.
Five is muscular branch.
Okay, that was it. Good. Right. You told me almost everything. Okay, can you tell me what are the muscles which are involved in the movement of your joint?
For the flexion, it is iliopsoas, and for extension, it is gluteus maximus, and hamstring muscles also helps. And for the abduction, it is the gluteus medius and minimus. And regarding adduction, it is adductor magnus, adductor longus, and cerebralis.
Okay, good. You did tell me about the femoral nerve. If you can tell me about the root value and the force of the femoral nerve, please.
Femoral nerve originates from the anterior arms of L2, L3, L4,
Yes,
and it passes through the
yes,
psoas major,
Yes.
and it enters the femoral triangle under the inguinal ligament, and around 4 centimeter below the inguinal ligament it gives anterior and posterior division. The anterior division supplies the sartorius and the pectineus, while the posterior division supplies the uh, extensor muscles that are the rectus femoris, vastus latalis, vastus femoris, and vastus intermedius, and it extends the saphenous nerve.
Okay, can you name the branches of the femoral nerve?
And
Any branches? It gives
only
yes,
saphenous nerve.
gives branches to the quadriceps while there, and also
Yes,
to
ma'am.
the
Quadriceps.
sartorius,
Yes, sartorius,
pectineus, and
pectineus, and some
yeah, some
cutaneous branches.
cutaneous branches. Good. Good. Thank you.
Thank you.
And